What we first started with in 1976 was the Hyde Amendment, which was an amendment passed that said that federal funds would never be used to pay for abortions. And it was basically used to pacify some of the anti-choice people into being more comfortable with Roe v. Wade. So when we came into this healthcare discussion, the Hyde Amendment should have been continued into healthcare. There are 17 states that currently use segregation of funds in Medicaid to be able to pay for abortions. And using the Hyde Amendment, they came up with this segregation of funds idea so that federal funds wouldn't be used to pay for abortions in Medicaid, but they could use state funds to pay for abortion. So the idea would be, when in regards to a health care bill in the House, that any money that I would pay into it could be segregated from federal funds, like in the public option or in the exchange. And then that way, women who use the insurance that came through the exchange or through the public option could still have an abortion as an option. So Lois Capps introduced the Capps Amendment, which is now, I think we're calling it the Capps Compromise, which would continue the Hyde Amendment, and it would ensure that in the exchange there's at least one insurance plan that provides for abortion and at least one that does not. So each individual has the right to choose. The Hyde Amendment really was unfair to especially low-income women. It specifically targeted them and said, we're going to deny you of a legal and legitimate healthcare procedure. So Stupak took that a step further and said, not only will we deny low-income women, we will also begin to deny middle-income women. So anyone that would participate in the public option would not be able to obtain an insurance plan that provided for abortion. And then they went even further and said that federal funds, or anyone that was receiving federal funds as an affordability credit in the exchange would also not be able to use that money to get an insurance plan that provided for abortion. So basically, if like Blue Cross Blue Shield, if they wanted to have a plan in the exchange, they would need to provide for one plan that didn't provide for an abortion, and then they would have like an exact duplicate of that plan, but with abortion for the less than 20% of people, I believe, that would be in the exchange that did not receive affordability credits. So it's really inconceivable that these major healthcare providers are going to slip this in. So the alternative is that women would have to buy extra abortion riders, which in itself is just a joke.
And also, it's kind of an invasion of privacy in the sense that you have to step forward and say, I'm somebody who might want to consider an abortion. Right. Nobody should have to out themselves like that, or that's nobody's business. That shouldn't be something.
Even Olympia Snowe from Maine, who's a Republican, is very against requiring abortion riders because it is such an invasion of privacy.
People aren't getting is that there really isn't any sort of economic incentive for insurance. And I think you already said that, but there's no incentive for insurance companies to provide a separate rider or a separate plan that covers abortion. Like she said, it's less than 20% of the population. So there's not really any sort of incentive for them to go forward and do something like that. But then again, we're still leaving out like low-income women and women of color and women on disability who have federal funding and just
Well, in the House bill, anyone who's eligible for an affordability credit is it's 400% above the poverty line or less. So for a single person, it's anyone making less than $43,000. A family of three is household income of less than $73,000, and a family of four is less than $88,000. I mean, that's a lot of people. I don't know what kind of people you hang out with, but everyone I know is eligible for affordability credits. So, I mean, we would all be denied like I said before, a legal and legitimate medical procedure. And I don't know if you all watched the debates on C-SPAN like I did, but, they like to use all the buzzwords and the scare tactics like, this healthcare plan is going to ration healthcare and it's going to take away our freedom of choice and blah, 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 blah. But then that's exactly what they want to do with this Stupak Amendment, is to say that, sure, abortion is legal, but, 2/3 of the population just doesn't have access to it anymore. So sorry. Nelson and Hatch introduced a very similar amendment that thankfully was voted down in the Senate. So now we just have to be worried about, what's going to be passed in the Senate and then the final compromise bill. We would like to see something similar to the CAPS amendment go through. But I think when it's all said and done and this is kind of settled, what we really need to do is take on the Hyde Amendment, because this is where it all started. There's actually a campaign out there called 30 Years is Enough, and it's the national network of abortion funds. Chicago Abortion Fund is part of that, and they're great. The Hyde Amendment, it's done. Its time has passed, and, it's just opening up more room for debate about what should be allowed and what shouldn't be allowed, when the fact is it's none of their business what should be allowed.
And also, we shouldn't be treating, people, women, low-income women, anybody who is on federal funding, treating them as less than equal than women who are privileged and able to have health insurance that covers abortion, whoever has the financial means to get that. We shouldn't be treating them any less equal than we are.
It's very open, the fact that the Catholic bishops had a lot to do with the Stupak Amendment being introduced and being passed, and it blows my mind that we just don't care about separation of church and state anymore. And, out there working on the reproductive rights team and being a part of that for so long, every time we have a protest, every time we have a rally, anytime we go anywhere, the people that are out there with those disgusting signs are white men of a certain age who happen to also be part of the Catholic League. And, I don't understand why the religious groups still have so much influence. It's very clear that the First Amendment provides for a separation of church and state, and that's the way I think it ought to be. And I think we need to start calling out politicians for legislating based on their personal religious beliefs. Because we all know that this is just a ploy to trash the entire health care bill, or any health care bill that comes through, whether it's the one we have now or single payer or whatnot. Women's reproductive rights are going to be used as a tool to trash the entire health care system, because it is led by Democrats and because it is President Obama, and that's just the facts. So we just have to get real and get the religious groups out of the negotiating table. I read an article today that was just trying to say that, there's a lot of buyer's remorse when it comes to the Democrats that voted for the Stupak Amendment. But I have a hard time believing that, because it was spelled out very clearly what Stupak was going to do from the get-go. And, it's no surprise that, the day after people were upset. So, and it was kind of slipped in on the sly, honestly. I remember it came up Friday afternoon, and then it was voted on Saturday. So, but come on. You pay people to know that to figure out what your constituents want, and I think it's very obvious. We've been talking about this for how many years now? And, they have no excuse. Thank you so much for having us. I really, really appreciate it. And, we would love to get our two groups together and, strengthen numbers.